I'm Julie Posetti. I'm the Global Research Director for the International Centre for Journalists, ICFJ, and you're joining us for another in our series of webinars during the COVID-19 crisis, part of our forum, Global Health Forum on crisis reporting connected to COVID-19. And today we're going to be talking about covering the infodemic, navigating the infodemic, or perhaps we should term this covering the disinfodemic. I'm going to share with you some research that we're just publishing as we go to air, so to speak, about that very theme. But just to give us some background for this discussion, I'll introduce our guests in a moment. It's important to note that as we continue to grapple with COVID-19 as a pandemic, we're faced with a parallel crisis, and that's a crisis that the World Health Organization has called an infodemic. Many of you would have heard that by now. And that's the idea of an ever-increasing flood of misinformation, disinformation, and just a pile-on of information. And the public struggle to try and separate fact from fiction, truth from rumors, and that total amount of information as the pandemic itself spreads. So as I said, today, ICFJ has actually published 2 new research reports in partnership with the United Nations, in fact, with UNESCO. And these reports describe the flood of potentially deadly disinformation connected to COVID-19. We're calling this a disinfodemic because of what we've mapped. So we've identified 9 main themes of disinformation connected to the pandemic, along with 4 different types of distribution methods and 10 ways that we're seeing organizations, companies, governments, intergovernmental organizations around the world responding to this crisis, often with significant implications for media freedom, among other human rights. So we'll be reporting on IJNet and on ICFJ and through our social channels, as will UNESCO as well, about this research as the day goes on and the week goes on. But we're going to be using the disinfodemic hashtag on social media also to have a discussion about that research. But first, I need to introduce you to our guests, and they're going to be discussing these very issues, how to cover the infodemic and the disinfodemic, or what we can do to prepare ourselves and perhaps partly inoculate ourselves against this flood of disinformation. So joining us is Andy Carvin. He's a senior fellow at the Digital Forensic Research Lab, DFR Lab as it's known, and he's joined by Indian health journalist Nayantara Narayanan. She's with Proto, which is a partner project of ICFJ. And as I said, we're going to be taking a look at global trends in COVID-19 disinformation. I mean, some of the things we've together been observing are scams and crackdowns connected to disinformation, issues around health equipment, attacks on journalists who are critical of those in power, and assaults on democracy itself that are designed to seed panic and certainly have an impact on global markets. So that's what we've been observing. We want you, those of you participating in this webinar, to participate by asking questions either within the Facebook forum that ICFJ has running, or through the webinar interface if you've registered for this webinar. And if you're watching this in delay, as many people do, then I suggest you ask to join if you're a journalist, ICFJ and IJNet's Global Health Crisis Reporting Forum, and we'll follow up on some of the issues there. So Andy, let's get this conversation rolling. Sure. You're a journalist, originally having worked with NPR and others, but you're known to many of us as a pioneer, really, of social journalism or social reporting, courtesy of that pretty extraordinary work you did around the Arab Spring. And you kind of introduced us to the concept, really, of open verification, for example. So the sorts of methods that we deployed in the context of what we might refer fondly now to, a web that felt less weaponized than it does today, where disinformation was perhaps not the word that rolled off our tongue when we started talking about social media. So I'm particularly interested, given that background, to hear from you about what you're observing in your role as a senior research fellow with the Atlantic Council's lab, looking at disinformation, particularly on the social web, in the context of this pandemic. Can you just reflect on that, perhaps that trajectory from the front line of surfacing reporting
Sure.
and to now?
Well, I think the perspective I can give is actually coming from more the point of view of an editor now, because I've been serving as interim editor at DFR Lab for a while now, and I coordinate all of our COVID-19 coverage. And so I'm not doing much original reporting myself anymore, but we have a team of nearly 20 reporters on 5 different continents monitoring information environments in their local languages and their local cultures. Normally we do this year round in times when there isn't a pandemic going on, but we've turned all of our attention to COVID-19 and we're almost exclusively reporting on it at this point. And yeah, I mean, a lot has certainly changed over the last 10 years on social media, to the point where everything's somewhat spun out of control. So what we try to do at the DFR Lab is try to get a better sense of where misinformation and disinformation is coming from, who's behind it, and what their motivations are. And in the case of COVID-19, there have really been 5 threads that we see emerging again and again. The first being is convergences of authoritarian narratives. Historically, for example, you would see disinformation that came out of Russia versus China very differently. Russia always seemed to be the joker of the internet, in the sense of wanting to set the world on fire and create chaos and divisiveness, whereas China was very much more focused on maintaining their public brand, projecting their soft power. And so they both used disinformation in various ways, but they had a different way of looking at it. But recently that's converged. We're seeing much more coming out of China that's more antagonistic, talking about bioweapons coming out of the US Army, while at the same time, while Russia continues to do its traditional types of disinformation, they're also talking about their humanitarian efforts. So they're talking about their soft power. We're also seeing economic disinformation. Sometimes it's very targeted to consumers, where people are trying to sell quack cures and the like. Other times it's as sophisticated as trying to destabilize economies, such as when Russian sources were reporting that Boris Johnson was on a ventilator, and thus suggesting he was on the verge of death. That could have very easily destabilized British markets if it had been picked up beyond the fringes. Then you have general exploitation efforts. So this is religious exploitation, political exploitation, people trying to rally their bases. It sometimes comes in the form of COVID deniers, such as President Bolsonaro in Brazil or Lukashenko in Belarus. And then the last one you could describe as old narrative, but new COVID twist. So the bioweapons is a good example, because there's been disinfo about bioweapons and chemical weapons since the beginning of the Cold War. And one recent narrative we uncovered, there was a rumor spreading in Italy saying that helicopters were going to spread chemicals on the populace to fight COVID-19. And within 2 weeks, the narrative had morphed to 30 countries, at least 30 countries, into many different languages, all taking on different themes and styles based on what might have resonated the most in those particular countries. So in a sense, it mutated like a virus would and became different informational strains. But what's interesting is that the rumor is based somewhat on actual world events, because in the US, for example, when it's mosquito season, it's not unusual to see municipalities spraying against mosquitoes. When the Zika outbreak happened, both in Brazil and when it became a concern in Miami, there was spraying taking place from a variety of vehicles. Drones have been used in China to spray chemicals in certain tests against COVID-19. And so, while it seems like one of those black helicopter conspiracies that you would hear against the UN or whatever, because it sounds like a combination of traditional conspiracy theories with some actual historical events, it takes on a life of its own, and it becomes usable by people across the political spectrum based on their interests.
And we can certainly see that unfolding to an extent in the US, in terms of some of the narratives that are being taken forward in protests. At least
Oh,
that's
very
what
much so. Like
yeah.
everything regarding chloroquine and hydroxychloroquine and the many narratives that have come out of that. We've seen similar narratives related to interferon being a miracle cure that's popped up in Latin America and even in South Africa too. And so there definitely seem to be themes that reemerge again and again, and not always disinfo. There's a decent amount of what we're seeing is good old-fashioned misinformation, people panicking, people sharing rumors they've heard, things that are completely unattributable but take on a life of its own, which is why I really like the World Health Organization's use of the term infodemic, because whether it's real information or false information, it's increasing at an exponential rate, not unlike the pandemic itself.
Indeed. And we'll come back to some of those issues and terms in a little while. Nayantara, I want to come to you now. You're a very experienced reporter on issues of health and medicine, and you're now involved in various, doing your own reporting, but involved in various projects designed to sort of assist journalism more broadly, I suppose, to apply some of these techniques to covering a pandemic. Can you just talk to us first of all about what you're seeing and hearing about on the ground in India, particularly for those people who are watching India from a distance and seeing that, you know, many of the memes around treatments and cures, for example, seem to have some kind of, you know, connection to India, whether it's applying a myth like drinking cow urine or, you know, whatever else it may be. There's identification of both the source and the themes of some of that disinformation being prevalent in India. So what have you observed?
Yes, you know, first of all, being on the ground here in the time of social distancing and lockdown is very much being at home, but watching all these things on various platforms and social media just coming at you, people you've been talking to before, having a lot of phone conversations. But there's various kinds of misinformation and disinformation. And I should probably leave you to decide which is which. So the first thing is we've seen the kind of things that we've seen everywhere in the world, and what you mentioned, you know, that this virus has been manufactured in some kind of lab in China. The kind of narrative that hydroxychloroquine is a game changer drug. I've actually seen the word game changer being used a lot, even in the mainstream media. But yes, unfortunately, some of the misinformation has come out from one of our union ministries itself, which is the Ministry for Ayush, which is supposed to promote alternative medicine. So this is Ayurveda, yoga, homeopathy. And very early on, when people were getting affected by COVID, we were seeing, you know, a few cases here. They put out some kind of advisory on how some of these alternative therapies can be used to manage COVID symptoms. Now, of course, there was a huge pushback from this, from the scientific community, from public health activists, and they kind of pedaled back and said that no, we mean that it will just boost immunity at this time of the pandemic, which again is not proven by any kind of global acceptable standard. So one of those things was that cow urine boosts immunity or helps you not get COVID in some way. Now, we've heard this thing about that cow urine is some kind of panacea for all sorts of things in the last few years. But on the ground, we actually saw people having a party where they all shared, where they all drank cow urine. And by the way, completely ignoring all norms of social distancing. People were all, you know, sitting very close together and having this cow urine party. And one of the people who attended that actually felt very sick. Yes, I mean, so this kind of information is going around, and it's very rampant. The other rumor that's been going around, particularly in India, I think, is this thing about temperature and the virus, that, when it gets hot enough in the Indian summer, we're not, Indians aren't going to be affected. And as a virologist just pointed out to me just an hour ago on the other webinar that I was on, that this probably came from a group of climate scientists tracking the course of the virus in places that had been badly affected, like Wuhan in New York, where the temperature is very different. But of course, correlation is not causation.
Yes.
It's been picked up as, oh no, we're not going to get it so badly here in India.
That's a really important point. Correlation is not causation, which is something we are familiar with if we've been, science reporters or health reporters, perhaps, with developing expertise over a period of time. But when you're in the midst of reporting an incredibly fast-moving pandemic, which has its associated infodemic and certainly the disinfodemic as well, based on our research, you end up in a situation where you haven't even got time to perhaps do in-depth interviews with sources that you rely on and trust, let alone find multiple news sources, perhaps. I mean, that's the experience, I'm sure, of some journalists, particularly in under-resourced news organizations in parts of the world where, this is hit hard. So can I just ask you to reflect on that a bit, Nayantara, if you're presented with these sorts of myths, legends, memes, whatever format or theme this erroneous health information connected to COVID-19 takes, what's the first step that you would take, if you were in a news reporting role trying to navigate this?
Right. Again, this is a conversation I've been having with multiple people covering the pandemic. And I think the first thing is to go to the experts that you trust and actually talk to multiple sources, multiple primary sources, to try and figure out, to come as close to the truth as possible. The other thing that is very important, of course, is to know that in many of these situations, there are no black and white answers. A lot of these myths and rumors are based on a grain of truth and then lived into something else. Very often, they split into false binaries. For example, here in India, a lot of people, a lot of journalists, a lot of public health activists have been asking for more testing from the beginning of the pandemic. And there was very little testing right in the beginning. And then this somehow evolved into a conversation about, why are people asking for more testing? Because we can't test everyone in the country. And that is a completely false binary, right? Asking for more testing is not asking to test everyone.
Everybody, yeah.
Yeah, we have to have the data to make decisions for people to know how long this lockdown has to last. I think the first thing is probably to point out, to flag those holes in the information and say that we don't know. I think that is something that's critical in a situation like this.
Yeah, so acknowledging where there are gaps in knowledge and doing the sort of critical reportage that you would expect anybody to be doing in any context, which I have certainly witnessed in the UK and in observing the Australian environment, which is my home country, a reluctance to be robustly critical of even political leaders spreading disinformation or misinformation, because of this sense that we're fighting a pandemic, we have to support public health efforts. So I wouldn't mind coming back to that in a moment. But just on that point, and Andy, you alluded to this, you've both alluded to it, this intersection of politically motivated or political mis or disinformation and COVID-19, and the ways in which we're seeing politicians, in fact, suggest strongly that a particular medication is a cure or an effective treatment, or will be, or is about to be declared as such. That's a particularly difficult kind of narrative to counter, isn't it? When you're looking for leadership as a citizen in the midst of a pandemic. Andy, can I just get you to unpack that a bit more? I mean, you gave us several examples of where you're seeing that happening around the world. Let's start with the way your team is reporting on this. What approach are you taking?
Well, we basically take an approach similar to what we were just discussing, in that you have to have a critical eye and you have to admit what we don't know. And whether it's people pointing to hydroxychloroquine or interferon or cow urine or whatever, I mean, some of them are a little easier to dismiss than others, but the science, for the most part, has been limited in terms of testing in this particular context. We finally started seeing in the last few days more evidence about the deleterious effects of hydroxychloroquine and how it could actually be making the situation much worse for a number of patients. And the thing that
including death, right? I mean,
including death, yes, exactly.
In the US.
Yes, so perhaps I'm putting it a little too mildly. And what worries me is when politicians point to any particular solution and use it as a way to rally their bases, to give them false hope, and also as a way of deflecting blame from themselves for not having their act together in terms of other logistics related to pandemic prevention. It's very, very easy to come up with excuses blaming others for the situation, which is why you see phrases like foreign virus and China virus used with lots of stigma here in the US, but very politically intentionally. But also regarding the chloroquines, I think by giving that false sense of hope, it allows people to rally around it, and it reinforces other behaviors, such as let's organize these rallies to start the economies again and go out in public and stop social distancing, because hydroxychloroquine is going to eventually save the day. And so one misleading bit of advice leads to a cascade of others that actually makes the situation much worse, because not everyone is going to be a part of a clinical trial involving these drugs, but a lot more other people might be directly or indirectly affected by others who decided to go out because they felt like a cure was around the corner, and they'd be able to take a drug and suddenly get better because a political leader told them that was going to be the case.
Yeah, so you've got this combination of disinformation and trust in the political leadership that is in fact spreading the disinformation or the misinformation. It's with really physical consequences.
Right, absolutely. Yeah. And because of the war on science and the war on expertise we've seen in the US and elsewhere in recent years, for the early stages of the pandemic, it wasn't too surprising to see a number of American politicians being dismissive about early projections and whether or not this was flu-like or even connected to the flu. Even though scientists were already doing full genomic sequencing of the virus in different countries, you still keep hearing, well, we just don't know. And the thing about that is, that's also the kind of thing you'd want a journalist to say or a scientist to say when the jury actually is out. And so even the language that we would encourage journalists to use, saying, well, we're not sure yet, the jury is still out, we're waiting for more scientific studies, that too can be weaponized to dismiss science when it's actually straightforward and well documented. Yeah. And so in some ways, it's a lose-lose situation of no matter how we find ways of phrasing it in a way that is helpful from a journalistic or public health perspective, someone's going to find a clever way of twisting it and using that exact same language.
Well, we've talked about the intersection of political rhetoric and disinformation here, and the conflict between trust and risk. But we've got a question from one of our viewers, Janeth Sekar, who asks about another intersection, and that's the intersection between religious bigotry and COVID-19 disinformation. So I think we'll put this to you first, Nayantara, because we've certainly seen escalation in communal violence in India, where Muslims, for example, have been targeted as perhaps being perceived to be, greater vectors of the virus, which seems from a distance to be deepening the polarizations there. Can you reflect on that for us? What have you observed?
Julie, I would say that the escalation in religious violence has been happening for a few years now. The COVID-19 pandemic has continued that. Very surprisingly, COVID has become another excuse for communalization. And I say it surprisingly because when we saw the first few incidents, a lot of us in India were like, how did we manage to make this also about Hindus versus Muslims, etc. And it really began with one event, a religious gathering in New Delhi, which was later found, there were COVID cases found from there. The thing we must remember is that this gathering happened before there was any kind of lockdown. It happened on days, on one of the days of that gathering, public health officials had actually come out and said that coronavirus is not a health emergency for India. It was a time when we were still getting used to social distancing. People, states and cities were they were closing down parks and schools and colleges, but the full impact of what was going to happen had not hit us yet. And there were many such gatherings happening around. But once this happened, and once there were many, like thousands of cases that came out of that particular event, the narrative has just been so communally charged that people, they started using it. The event was Tablighi Jamaat, and they started calling this the Jamaati virus, so Jamaati Jihad. And you'll see this on news channels, you'll see it all across social media. And that has, from there, that triggered off, I think, a spate of these fake news videos that would go around on WhatsApp and other social media, saying that Muslims were deliberately spitting in places around people to spread the virus, that, old videos were repurposed, to kind of spread this narrative. And this has had real world impacts in parts of India and Uttar Pradesh. Muslim vendors have been stopped from Muslim vegetable vendors have been told to shut shop and go away. People actually there was one news report that said people actually even returned the vegetables that they bought from these particular vendors. So these people are losing their livelihoods. Yes, there's also been actual violence against people. There was a hospital in some city, I don't remember where, that actually had a sign outside saying that we will not treat Muslim patients, which completely goes against any principles that any medical professional should have. So yes, this is taken a very unfortunate, very communal turn in India, and as we speak, it's going on. You see new events, for example, the announcement of the extension of the lockdown that happened just a few days ago. On that day, there was a huge gathering of migrants outside a railway station in Bombay, because they had been waiting for the lockdown to be lifted to go back home because they weren't finding work in Bombay. And, also in the middle of a pandemic, everyone wants to go home. What's been established is that people gathered there based on two rumors. One was that train services were going to be started again. And the second was that there was going to be distribution of food. Neither of these things were happening. So there were thousands of these migrant laborers outside the station, who were eventually dispersed by the police. The narrative on a lot of news channels that evening and later was that these people had gathered near the mosque. Now, yes, there was a mosque there, but people had actually gathered outside the station. So that's the way this narrative is being, that's how it's going in India, where there's a blame game on the, putting the onus of the spread of the virus on the Muslims.
Which does seem to be, I mean, we've found that, you've mentioned that, Andy, we've seen it in reporting, we've certainly found it in our research, this crossover between xenophobia, racism, and religious bigotry, and COVID-19 disinformation. It's one of the really evident trends that's emerging. So
I can also point out, before this whole anti-Muslim rhetoric began here, in the early part of the epidemic in India, there was a lot of violent behavior towards people from the Northeast who have, whose physical features are compared with people from China. In fact, this kind of bigotry was seen even before, like in metros, people would be called names based on how they look. But this whole Chinese virus thing actually led to a spate of bizarre incidents, like people would spitting on women from the Northeast and say, go Corona, go, or go back to China, and really weird things like that. So it's not just the communal angle here, it's also other.
It's the racism as well. I mean, it's so frightening, really, as though the virus is not frightening enough to be in a situation where you see this social breakdown. But we've got a question from several people, but one that I think we should take now. It's from Uganda. Joshua Kisawuzi, sorry Joshua if I'm getting your name wrong. He points to the fact that in trying to cover these incredibly complex and frankly high risk stories, whether they're being reported remotely with all of the digital risks and threats that go with delving into this territory of investigating disinformation, or physically, he points to the risk associated with journalists asking challenging questions and seeking to investigate in the context of a government threatening to arrest, remove the license for reporting if they're operating in a country where licensing is in place applied to journalism, or being threatened with other judicial or law enforcement measures for trying to do their job. So this is, in parallel with the need to deepen our expertise and our, commitment to robust traditional reporting methods, along with the more kind of, the anti-specialist area of the sort of digital forensics. We have this other challenge of states, law enforcement and others applying these sorts of regulations. What's your response to that as another source of risk and threat for journalists trying to cover this stuff? Have you, Andy, had to deal with any of this with your reporters who may be working in countries where this is a threat?
Well, for reporters of ours that are in countries or regions that have potential threats, so far COVID-19 has been the least of our worries, because these are often states that have oppressive regimes or have neighbors that are oppressive regimes and are exerting an extraordinary amount of pressure on their home countries, or they don't want us reporting on certain things because it reflects poorly on the political party in power. And so in a sense, not much has changed for us because they were already at risk.
Okay, so you already had those.
Right. And I think in countries where journalists are under threat due to their COVID-19 coverage, in most cases at least, they're countries that already bullied and threatened and arrested journalists for other reasons, which is why I don't have much very good advice, unfortunately, beyond the traditional advice that one would give to reporters working in oppressive environments about maintaining informational security and the like. But that's, if you're a local reporter in a community and you're working for a local community radio and things like that, all the operational security in the world isn't going to help you if you're trying to cover the safety of your community, whether it's due to governmental oppression or due to COVID-19. And so it's a very depressing situation that certain governments are using COVID-19 as yet another excuse to prevent freedom of the press.
And there have been incidents and cases in India as well. I don't know, Nayantara, if you're able to reflect on this or to identify them, but I've certainly heard it from other Indian editors and journalists that there's been, pressure applied, for example, to publish in line with government perspectives, for example. So do you have any insight into how that affects attempts to investigate? One of the examples this journalist gave was when trying to investigate officials, perhaps engaged in fraud or theft using the cover of COVID-19, and how to go about investigating that sort of thing.
Well, that's one I haven't heard, Julie, but that's something people should look into. I think a large problem here is that, yes, there is pressure on journalists to do positive stories. It's been reported that the Prime Minister himself had a video conference with several editors and asked them to portray the government's work in a positive light. But there's also been a lot, the health ministry in its briefings itself has been very opaque. It's restricted journalists' access to them progressively. And in a situation where we're in lockdown and you're only webcasting your briefing and you're cherry picking a couple of questions out of several questions that are submitted to you. This is what I'm hearing from other journalists. That's what they have to deal with. So on the one hand, the government is saying that, don't misreport. But on the other hand, they aren't answering journalist questions accurately or on time very often. So yes, it's a huge problem that my colleagues are facing here.
So one of the other questions is one that's common to those of us who've worked in the space of combating disinformation or misinformation through journalistic endeavours, and that is whether to ignore and when to ignore evidence of misinformation and disinformation. Now, I know our colleagues at First Draft and other organisations have written and researched on this theme about when it's appropriate to signal content and to surface it for a broader audience and when it's not. Andy, what's your experience and advice on this? What do you apply in your environment?
Well, when we see a narrative emerging, the first thing we ask ourselves is, does it have any traction yet? Or is it just some random guy screaming into the infinite internet hoping that it takes hold? If it doesn't have traction, we will note it. We'll sometimes continue to track it, but we don't make a stink about it, because that's what a lot of these bad actors are looking for. They want the attention. And so while there is no, I don't believe that there should be a formula to say when something has reached traction. I think you just need to use editorial judgment as to whether it's happened or not. But there are times when essentially an idea has gotten out into the wild and is on the verge of taking on a life of its own, or it's clearly beginning to impact certain populations. That's when I think it's important to start covering it. But what I worry about is, even though I'm an enormous supporter of fact-checking organizations and fact-checkers in general, I do worry about exhaustion, fact-checking exhaustion by the public, as well as people who spread misinformation or believe in mis or disinformation. They don't care what fact checkers are saying anyways, because it reinforces their beliefs, which is why I think George Lakoff had it right a couple years back when he started talking about presenting mis and disinformation as part of a truth sandwich. The idea being is if you are going to fact check something, rather than just saying so-and-so is claiming that something has happened and here's why they're wrong, what you do is you start your coverage by talking about what the truth is, and then in the middle of it, you then mention the fact that some people are getting it absolutely wrong and are being misleading about it, and then go back to the truth again. And so the misleading information gets sandwiched in an informational package that's reinforcing the truth, rather than making it seem like we're always playing defense. Because fact-checking in many ways often comes across as defensive. So how do you take that and do it on a stronger, more confident footing, so we can call BS in a way that actually has traction?
I mean, look at the debates at the moment in the US around live press conferences from the president,
Right.
where there have been many calls for those broadcasts to end from very reputable journalists, editors, and media academics, for example. I'm not sure what your perspective on that is, but I've noticed recently, I mean, CNN is still broadcasting live, but trying to run tickers across the bottom of the screen with the, the occasional real-time fact check as they're able to, under enormous pressure. Now this was doing, I noticed, live Facebook video streaming in parallel with the president's address this week.
Yeah.
These,
I mean, honestly, the only way I think that could work is if they made it funny.
yeah.
You know, I think if the John Olivers of the world or the
Yeah.
Trevor Noahs, I think if they took it upon themselves to live stream events and put their teams of writers and improvisational comedians to be responding in real time, so
Yeah.
people can understand that so many of these events are political stunts and jokes, it then puts sharers of misinformation and disinformation on a defensive footing. I mean, I personally am getting increasingly uncomfortable with airing of press conferences without being able to keep false information in check. And so if you absolutely have to do it, find a way of mocking it, or find a way of presenting it in a way that people, from the moment they turn on the stream, they go in with a skeptical eye and understand that we can't trust what's being said.
I mean, once again, we turn to the, I mean, it's an excellent idea. And once again, we turn to the satirists to defend us from fake news.
And, you know, and when it comes to fighting misinformation and disinformation, I think humor is one of the best tools we have. I think since given a certain percentage of the population that's going to believe conspiracy theories and rumors and aren't going to listen to fact checkers, if they're more likely to listen to comedians, especially ones that are of similar backgrounds, then that's what we should be doing more of.
Okay, what's your view on that problem, Nayantara? I mean, I know, for example, having worked closely with the Quint in India, that efforts around collaborative fact checking, and particularly high rotation debunk stories is something that they've practiced. And I know that's also an approach that Rappler in the Philippines, for example, which has been, a massive target of disinformation campaigns, orchestrated and otherwise, they do something similar. But to the point about whether we get to a stage of fact check fatigue, particularly in the context of an infodemic, what do you observe is the best way to deal with this? I mean, are there parameters that you would suggest?
Right. So in India, I have to give a shout out to Alt News, which is a fantastic fact-checking organization. And seeing how people have responded to Alt News fact checks and Alt News stories during this time, I don't believe that there is fact-checking fatigue here yet. I know that there is this joke that this is probably true of anywhere in the world, but family WhatsApp groups are really the place where all misinformation happens. And I've seen several people sharing alt news fact checks every time someone shares a doctored video or a clipped a video or some bizarre news article on their WhatsApp groups. So I haven't seen that happening here yet. Maybe it will. But, I think Andy had a great point that people who don't want to believe, the fact checking is not going to make a difference to them. I mean, any narrative can be twisted into things that they want to believe.
There's also some evidence from research too that it in fact works as a reinforcement, because fact checkers are perceived to be representatives of the enemy, the political camp.
But Nayantara just made an extremely important point regarding the community WhatsApp groups with people within the groups sharing fact checks. To me, that reinforces the idea that combating misinformation and disinformation, especially during a pandemic, it's a civic duty that requires everyone's involvement. If it's only professionals working to correct the public record or clarify what the science is, there will continue to be misinformation and disinformation spreading. But if you're able to get people to realize that they need to be looking out for the safety of their families, their friends, their communities, in the same way that people in many parts of the world have embraced social distancing as a civic duty, distancing ourselves from misinformation and disinformation is almost as important, if not more important, in some contexts. And so the question is, how do you communicate the message to a broader public that now we've gotten all of you to embrace flattening the curve? How, when it comes to the pandemic, how do you flatten the infodemic curve? Because we're not going to be able to do it all ourselves.
Yeah, and I think that's really both very important points. I mean, one of the things that I often reflect on is a conceptualization from a friend who's a South African academic called Julie Reid, and she has written about media freedom being a collective right and also a collective responsibility. And if we want to be able to indeed claim our rights to say what we want to whom we want when we want as citizens, in addition to being journalists, then surely we have this parallel responsibility that Andy's underlined to defend truth, to ensure that facts are surfaced, to debunk actively where possible. And I guess this is a really interesting twist on that description, Andy, that you gave. And I know this is a common view in the West, that we need to pull back, for example, from perhaps the rate of fact checks we're publicizing because of this perceived fatigue. But also because it can reinforce some of the myths themselves. But perhaps what we're saying is there's two tracks, that when it comes to dealing with the closed environments of messaging apps, for example, that's where every time we encounter disinformation within our network of 200 or 300 maximum people we're connected to, that we each as citizens have a responsibility to be the social journalists that a decade ago we were talking about everybody having the capacity to be.
Yeah, I think that's exactly it. And again, I just want to make clear, I'm not discouraging fact checking or suggesting that we should be doing less. I think we need to continue being aggressive about it, but think about how we're framing it and how to get it into the hands of the people who are most likely to be affected and to be essentially likely spreaders of disinformation as well. And I think the civic duty angle through community engagement is a big part of it. Which raises some interesting questions on ways news outlets should be partnering with community-based organizations that serve as intermediaries with a whole range of different community types.
Yeah, no, really, really important points. We have a question from Marion Daughtry, who is interested to know what your views are on measures taken by social media companies, for example, the tech intermediaries to counter disinformation. She highlights the early intervention of Pinterest, where if you looked up coronavirus, you got a message from WHO. And we've seen, on top of that, I can say from the research that we just published today, they've made a variety between them, the internet communications companies formerly known as platforms, that we have seen both investment in traditional journalism. We've seen suddenly an ability to try to downgrade the prominence of disinformation alongside elevating credible sources connected to coronavirus search. There's a whole lot of actions that for many years we've been told were not possible or not possible to do in a way that was sustainable, say connected to political disinformation. But what's your view, and we'll come to you first, Nayantara, because I think it's your turn. What's your view on the responses that you've observed from the platforms to this crisis?
From social media platforms?
Yeah, in terms of trying to fight the mis and disinformation within their own platforms and take responsibility. Let's look at that first.
Right. I mean, this is not something that I've been looking at very closely, Julie. I think Twitter did do something. I mean, I do see a few more instances, for instance, of accounts spreading disinformation either being blocked. That I don't think that I expected to see them before the pandemic. They might be taking it a little more seriously now, but I can't comment further on that.
No, that's okay. It's a question from somebody observing. Andy, what about you? in your work? I don't know if you have any active partnerships
Yeah,
with the
yeah.
platforms.
We have pretty good relations, generally very good relations with most of the platforms. And full disclosure, we receive funding from Facebook, but we see ourselves as a collaborative watchdog in which we find ways of working together while trying to identify what's working and what's not working on the various platforms. So for example, with Facebook, as they identify examples of inauthentic networked behavior on Facebook, they will often give us a heads up so we can begin doing forensic analysis. Well, we don't have access to any of their backend tools, but simply by observing what pages are publishing, who they're following, how they're interacting with each other, we're often able to paint a picture of how they're coordinated if they are. But I think all the platforms are really they're doing there are lots of people working at these platforms doing their level best to combat this, because they know how much it's affecting everyone, including their own families. But it's a challenge when you have any network that has hundreds of millions, if not billions of users. And if when platforms have methods of moderation that require human beings, which are generally necessary to make judgment calls, and those people start getting sick, then that becomes a challenge too. And so I think, it's tough. I think some people will sing their praises, some people will always find faults. I think it's a complicated situation, but seeing what's going on behind the scenes, I can see just the sheer amount of work a number of these platforms are taking in order to combat COVID-19, misinformation and disinformation actively and not passively.
Do you think there's anything they could do differently or better? I mean, they can always, of course, for anybody, there are possibilities. And I know we're in a very fast.
There probably is, but it's hard for me to make concrete recommendations since I'm not an engineer. I think there are probably some things that could be done on the engineering side of each platform, depending on how they're structured, that might be able to assist them. So for example, WhatsApp made the decision, I don't know if they made it globally or just in certain parts of the world, where the number of people you can message at once has been limited to what it was before. And they've done similar things in the past as a way to essentially, I mean, it's the WhatsApp equivalent of social distancing, because the fewer people that are able to pass something on at any given communication, it's flattening the curve in their own way. But so the only examples that come to mind, the only example that comes to mind of a platform really not doing anything is Telegram, because Telegram is it's based out of Russia. It's very well known as a place for nationalist groups, racist groups, and political actors and militants of all types. We've seen terrorists using Telegram quite actively over the years, and it's so hard to get a sense of who's behind the posts and who's behind the communities there. In many ways, Telegram worries me a lot more than WhatsApp does, because at least the people who work at WhatsApp recognize what the issues are and are trying to figure out, given how their platform is structured, what they can do to help alleviate disinformation.
Yeah, that's a really interesting point. I mean, Telegram is a platform that certainly many journalists turn to before they turn to Signal as a sort of secure, potentially, secure encrypted app, and we don't discuss it much anymore. But here we are.
Right, and having end-to-end encryption is extremely important for journalists and for sources and human rights activists and all that. But WhatsApp has end-to-end encryption, and yet they are working actively to think about what they can do within their systems to decrease the overall load of disinformation spreading. Whereas I don't get the sense that Telegram is doing much of anything.
Nayantara, can you reflect perhaps on some of the lessons you've learned over your career of reporting on health and science and the various, acts of mis and disinformation you've encountered, and just think about how those lessons could be applied to reporting this crisis. And if you can also address, because we're coming to the end of time, this question, and that is, what do you think journalists need most on the front line in India in the way of assistance to navigate this infodemic?
Well, I think essentially misinformation and disinformation plays off on fear. If I could just quickly give you an example from before the COVID-19 pandemic, a few years ago in Haryana, North India, there were a few villages that stopped sending their children to school because there were rumors going around that strangers in the area were injecting children to make them sterile. Now, this also took on a communal angle because the rumor was that people from Hindu groups were trying to sterilize Muslim children. Now, this happened in the middle of measles rubella campaign, and so all the ire was turned towards the healthcare workers then. Now, all this fear is already there. This misinformation is already there. It just gets exaggerated in a pandemic like this. So we have seen violence against healthcare workers over here, which is awful at a time like this. I mean, at any time, but especially a time like this. We even saw a doctor who died of COVID he wasn't allowed to his family was not allowed to bury him because there was all this misinformation about if the body was buried there, then the community would be at risk. So essentially, it's really important not just to debunk misinformation, but also give complete information, because I've noticed that incomplete information triggers the same sorts of fears.
Which is the context point that
it is
truth sandwich.
Yeah, absolutely. Yeah. But for instance, so I think that's one of the things that we have to keep in mind. And in terms of journalists being protected on the front line, well, again, journalists themselves need information. A lot of the people who are doing the work on the ground are not people who have covered health and science before. So they themselves need information in a situation like this. We've seen several journalists having tested positive now in India because perhaps they didn't have the information themselves.
Which it doesn't get more real than that, does it?
No.
Access to information being so essential as we try and confront this. And for everybody's amusement and edification, Andy has just been fact-checked in real time during our discussion, and he's already debunked the fact check. So somebody in our audience pointed out that, I'm trying to find you, Yelena Osipova-Stocker, she says that...
It's much more complicated than that, because Russia has restricted Telegram when Telegram users have used it to target Putin, but there are enormous pro-Russian channels and active users who use Telegram to support Russia's interests, particularly in their occupation of eastern Ukraine and as well as of parts of Georgia. So.
Yeah. So that's great. So the question from Yelena was around whether, in fact, Telegram was based out of Russia, and whether or not it was banned there. And if you are playing along at home after the live chat has disappeared, they are now both in agreement that there is context, always important.
Yeah, it's
complex.
It's very, very complicated. Yes.
Can we finish then, Andy, with you? We haven't talked much about some of the methods that you're using
Sure.
and how you're using them to try to report on the disinformation and misinformation swirling around this crisis. Can you just walk us through some of the things you're doing and what you're learning in the process?
Sure. Well, we're big fans of using publicly available data sets. So whenever we're able to dig deep into Twitter, Instagram, Facebook, and there are other search tools that are focused on searching on those platforms. We use them. We subscribe to different tools such as BuzzSumo and Brandwatch and Meltwater Explorer, which are all social media monitoring platforms. Generally, that part of that industry was created for brands to help them monitor how their businesses were doing, but you can also use it to monitor any sort of rhetorical threads or narratives taking place online. So we apply it to watching influence operations. But there are free tools out there that allow you to do it as well. For one of my favorites is called Tweet Beaver, of all things. So like tweet and the word beaver, like the mammal,
because
.com.
Twitface was taken. So.
Right, exactly. But TweetBeaver, what it allows you to do is it allows you to conduct searches on Twitter and investigate different user profiles and have these search results downloaded as a CSV file. So, for example, last summer, I took a look at a bunch of accounts in French and English that appeared to be supporting a warlord in Libya, and for reasons that didn't make any sense for these accounts. And so I used TweetBeaver to download about 100 of their timelines and put them into a giant CSV file and sort them based on what they were saying. And not only did we discover verbatim patterns of language used to support this warlord against the UN-aligned government in Libya, we discovered that there was all sorts of other rhetoric that was being expressed in these accounts supporting the political interests of the UAE. Didn't mean that the UAE was running this network. We couldn't find evidence that that was the case, but whoever was running it clearly had interests aligned with the UAE. And I wouldn't have known that if it hadn't been for the free tool TweetBeaver. And so, so like I said, there are tools out there that you can spend money on. But try to see what free and open source tools are out there and experiment. You'd be surprised what you can find through simple Google searches, especially if you find a particular narrative that has spelling mistakes in it or linguistic quirks that seem odd. Rather than searching for the keywords, search for the weird phrases, search for the mistakes. And just through searching on Google, you'd be surprised how you can jump from one platform to another. Last year, we traced an operation that we referred to as secondary infection, which was an attempt to undermine the EU parliamentary elections. And it was a Russian attempt using dozens and dozens of online platforms. And we were able to trace most of it because of Google searches, because they got sloppy and started using the same phrases again and again. And so you don't need fancy tools to begin doing this type of investigative work.
There's two prongs. I mean, you can do a kind of analysis of the text to determine patterns in the language, and you can also look at, the network analysis side of who's connected
and then
to who.
reverse image searches and things like that can help you in all sorts of different ways. And of course, if you have an online following that's constructive and supportive of your work, like I did during the Arab Spring, ask questions, tell them what you don't know, see if you can get help from them, because your social media follows can be an extraordinary resource.
Can I just ask one final question on that? Because it does fascinate me that, we have moved on considerably in the world of social journalism in that past decade, but we really have seen a rise in weaponization of the platforms for disinformation purposes, much more widespread than it was back then. Are you still using, I know you said you're much more of an editor now than a reporter, but are you still to an extent relying on those public open networks in the way that you did before, or is it harder to do that now?
It's a lot harder. That's a whole other webinar.
Well, we'll take that on.
Yeah, I guess I'll put it this way. I still monitor as much as I used to. I'm just not as active as I used to. I during the Arab Spring, given that there were days where I was tweeting 1,000 times a day, that was a bit much. In retrospect, I think there are better habits I've developed since then.
Yeah. All right. Well, let's actually suggest that as a future webinar, and I think people would be really enthusiastic about having you perhaps do something that's instructive in taking us through some of your methods where you can reveal them too. So I'm just going to put that out there. Thank you very much, Nayantara, for joining us from Bangalore. I was about to say Mumbai again. I'm sorry, from Bangalore, who's affiliated with Proto, and Andy Carvin from DFR Lab for your work. It's been really great to talk to you, and for everybody who participated really great to get your enthusiastic questions and comments as well, even a live fact check. So stay safe, everybody. Keep going with that incredible reporting and collaborative reporting that we're seeing evolve on a daily basis within the ICFJ and IJNet Global Health Crisis Reporting Forum, which we're really proud to facilitate. I think we've got around 2,600 journalists there now from all around the world, working with each other, supporting each other, and connecting with experts. So thank you very much again, and we'll see you next time. Thanks,
Thank
guys.
you. Stay safe,
Bye-bye.
everyone.
Thank you.